Hi, I'm Dr. Audrey. Today we're going to talk about hormonal pigmentation and the treatment thereof with laser therapies, which is a very interesting subject and a new way of thinking around the treatment of hormonal pigmentation. Very interesting. Lisha, thank you so much for coming today, and Marlies, as always, thank you for coming.
It's a privilege.
So we're going to talk about hormonal pigmentation, and the interesting fact about it is that you know how our vascular system supply blood even to the melanocytes, okay? And if there is a red component to the hormonal pigmentation, then it makes perfect sense to treat the red component first, and thereby actually switching off the melanocytes to make melanin or pigmentation, hormonal pigmentation.
That makes sense. It's incredible.
Yes,
I didn't know that.
I don't know if you remember, but in my days, you know, we were very bad, and we used to use sunbeds, and we used to lie on the sunbed, and we had these two white patches on your bum.
Even on your little wings.
Yes. And that's exactly the argument that we're using here. Where pressed against the sunbed, you didn't have blood supply to the melanocytes, so you didn't make pigmentation. And here, we're going to now cut off the blood supply to the melanocyte, or improve it, revascularize, and that's going to treat the hormonal component of the pigmentation.
Because hormonal pigmentation is the hardest pigmentation to treat anyway. So that's amazing news, isn't it?
Oh, very. Even so, Manish, you know that it's tough to treat, and we need to always be careful not to overpromise actually to our clients.
Because once you battle with pigmentation, you will always have pigmentation.
Well put. You can only bring it under control.
Yes.
As good as you can.
Yes, with regular monthly treatments and in salon,
I'm with you.
And then your home care product is very important.
I'm so with you. Preventing the pigmentation from forming, but also treating it at the same time.
Yes,
well done. So this treatment will actually have two parts. For the first part, we will use the DiVL module on the Harmony XL Pro system, and then the second part in the same session, we used also on the Harmony XL Pro, a non-ablative, meaning no scabs, Q-switched, building up of energy in the YAG laser. Yeah, so to further break up pigmentation, so the two combined. Vascular pigmentation, the two happily married. Well done. Good.